So today we have a young individual who has sustained injury to her right knee joint, and she has complete ACL tear and medial meniscus posterior horn tear. So on diagnostic arthroscopy you can make out that there is a complete longitudinal tear involving the under surface of the posterior horn of the medial meniscus. So this kind of tear needs to be repaired in this patient profile. You can see the joint is normal, so we need to repair this meniscus tear in order to prevent its further progression and inevitable early osteoarthritis in future. So we are going to use all inside device. So as you can see, I have introduced my first all inside device from the anteromedial portal. So now I'm going to pass my device from the anterior to the tear through the substance of the medial meniscus posterior horn. So as you can see, I have pierced my all inside device, and now I'm going to deploy my first implant. And now as I gradually pull back my device, and then you can see the second device is still inside, and now I am going to pierce the posterior capsule inferiorly. So now I have deployed my second device, and now I am going to pull my all inside device, and now I am going to pull the thread to tighten the knot. This is going to reduce the longitudinal under surface tear. So the length of tear in this patient is around 2 to 2.5 centimeter. So we are going to use two all inside device. Now I'm cutting the thread, and this completes the first all inside stitch. Now I'm checking the repair with the probe. It's quite strong. Now I'm going to introduce my second all inside device, which I'm going to apply more lateral to the first stitch. So I'm introducing my all inside device through the slotted cannula, and now I'm going to pierce the meniscus substance which is anterior to the tear. Once I have deployed my first implant, I am going to gradually withdraw my all inside device, and now I am going to engage the inferior capsule. So now I am piercing the implant through the inferior capsule, and then I am going to deploy the implant, and now I am going to tighten the knot by pulling the thread. You can see that the knot is gradually being tightened. It's a sliding locking knot, so when we pull the thread it's going to reduce. So now the tear is completely reduced. It's quite strong and robust. And now we are going to cut the thread again near the knot, and this is going to complete our arthroscopic meniscus repair with the help of all inside device. So this completes the second stitch. You can clearly see that with the help of two all inside stitches we could reduce the torn meniscus anatomically and quite strongly, and this is going to heal nicely because this is in a red white zone, so it's a vascular zone, and this is going to reduce the chances of further progression of the tear also in this patient. And as you can see, the joint is quite good, so this preservation of the meniscus is going to affect longevity of the knee joint and prevention of osteoarthritis in future. Thank you for watching this video.